afternoon, this is Dr. Salma Aziz, and today's topic is going to be plantar fasciitis. Yes, that long word, also known as or commonly known as heel pain. Let me first give you a quick review of the anatomy, because you know that's how I practice. So, looking at the bottom of the foot or the side of the foot, as we have our model here, there's a band of tissue that attaches to the heel bone and goes all the way to the tips of the toes, and that band is referred to as the plantar fascia, hence where the name plantar fasciitis comes from. This plantar fascia is basically made out of fibers that just don't stretch. It's very similar to our a piece of rope or our hair. And this factor becomes very important when we talk about the treatment of plantar fasciitis in just a few minutes. So we know that there's a band of tissue from the heel to the toes. It does not have any stretchability, and the length of this band is pretty much set when we're done growing as a teenager. What happens next as life goes on, as we all know, and as we get younger, is this arch of ours does tend to go more towards where gravity wants it to go to, and that is it starts to flatten out. As I'm showing you right here, that arch is flattening out. Recall that that band that attaches to the heel and goes to the toes has no stretchability. So if we have a foot that is collapsing, it's expecting that band to lengthen with it. But with the plantar fascia, we don't get lengthening. So you can imagine, given a single day, how many steps most of our feet take, what we're putting that band of tissue through. Every single time that the foot and arch collapses in this manner, there is pulling and tugging going on at the level of the insertion on the heel. And this is where most of us that suffer from plantar fascial pain end up having pain. Most of you have experienced this if you've suffered from plantar fasciitis, where with that first step in the morning, you have agonizing pain. A lot of patients come in and they say, I feel like I'm 100 years old. Well, the reason for that is this. Again, all night, the foot has had a chance to relax. The arch, the foot, the fibers, and the soft tissue structures all relax overnight. Then you decide to put that foot down onto the ground, and with that first step, when that arch collapses down, you're getting basically tearing, microscopic tearing of that band of tissue, also known as the plantar fascia. And that microscopic tearing is what initiates inflammation. Well, the inflammation is what your pain is coming from, hence the word plantar fasciitis. So we have to make sure that when we're talking about plantar fasciitis, we understand that there's two components to this. One, as I said before, is this flattening out, and two is this localized inflammation at the level of the insertion. So the treatment for, or a successful treatment for plantar fasciitis ends up being twofold. We have to address the inflammation and control the flattening of the arch. How do we address inflammation? Simple. We try to either put some localized cortisone in there, or a lot of times patients come in and they advise us that they've taken anti-inflammatories and that has helped them. Now that we've reduced the inflammation, we have to prevent this injury from reoccurring, and the way we do that is by means of our custom orthotics that we've talked about in great length before. So to demonstrate how an orthotic inside of our shoe will prevent that bad movement from occurring is as follows. Our foot is being controlled by this custom orthotic, and this bad movement that otherwise would have created the inflammation here is stopped, and as a result, we have eliminated the pain that patients come in with. The conservative treatment for plantar fasciitis is, if the deformity is caught early on, is greater than 85% success rate. And for those of you that are afraid that you have let your heel pain go on too long, no worries, because the surgical treatment, if we are in that small percentage of patient population that fails with conservative treatment, the surgical treatment for plantar fasciitis is very minimally invasive. It is nowadays done endoscopically with a great success rate as far as resolution of their heel pain. So don't be afraid. Get treatment, early treatment for your heel pain, and we can have your feet carry you through life pain-free. Thank you for watching today, and hopefully today's educational message was of use to you guys. Have a great day.